I'm Maria Kostylo. I'm Director of Staff Education and Infection Prevention for Ohana Pacific. I have been a nurse for 34 years. I've been with Ohana Pacific for 4 years. Prior to becoming a long-term care provider, I worked in acute care. So most of my nursing experience is in the hospitals. Back in St. Francis days, I worked for St. Francis. I did bone marrow and organ transplants. I was a manager. I was a CNO, and blah, blah, blah. And then St. Francis went away. Then we were Hawaii Medical Center, and then Hawaii Medical Center went away. And I actually moved to the mainland for a few years and then came back to work with Ohana Pacific. And I just absolutely love the company. Whoops, sorry. So that's my background. When I first got to Oahu, I was the DON at the villas for a couple of years, and then I moved into infection prevention and education, which is a much better fit for me. Of course, I didn't know there was going to be a pandemic around the corner when I made that move. But anyway, so I am here to talk about the vaccine, but before I start, does anybody have any questions about anything non-vaccine related, about COVID-19 or anything like that? You have questions about? All right then. So I will start. Get vaccinated. All right, so I'm just going to talk a little bit about the immune system in general, then we'll talk about the vaccine, and then I'll answer some frequently asked questions. And then at any time, if you have any questions about anything I'm saying or something comes to mind, please just speak right up, okay? This is very informal. This is just information for you all so that you can make an informed decision to get vaccinated. Okay. So basically your immune system is a miracle, okay? Your body, no matter what comes at it, keeps you safe. That is the whole purpose of your immune system, is if anything foreign enters your body, your immune system is going to attack it, surround it, get rid of it so that you stay healthy, okay? So in most cases, this is a wonderful thing, all right? In some cases, it's not so wonderful. So for example, I told you I was a transplant nurse for many years. If I get a liver transplant, my body is going to recognize that new liver as foreign, and it's going to do its best to try to reject it and get rid of it, which is why people that get organ transplants or bone marrow transplants, they have to be on immunosuppressants for the rest of their lives, because your immune system is always going to attack what it recognizes as foreign. That's its job, and we're thankful for it, because most of the time your immune system wins the fight and you stay healthy, right? Sometimes some people have overactive immune systems, like in rheumatoid arthritis or lupus, where your immune system is actually attacking yourself, and that's not a good thing. And then you have to go on immunosuppressants to keep that from progressing. So for the most part, in most of us, it's a wonderful miracle of nature that keeps us healthy. So you'll notice, you know, if you happen to cut yourself or you get a sliver or something, you'll notice it gets red, it gets kind of sore and tender. That's your white blood cells rushing to the area to fight off all of the foreign invaders that are trying to get in that break in your skin. It heals up, you're fine. Thank you, immune system, right? So with the COVID, it's the same thing. If somebody gets infected with the COVID virus, your immune system is trying to fight it off. Those people that have a strong immune system are going to keep it at a low level, so they may not have any symptoms, they may not feel sick, they may still have it, but they don't feel sick. Other people, the virus is winning the war, the immune system has to work harder, it's revving up, you feel sick, and sometimes the virus wins and sometimes the immune system wins, right? So as of today, we have over 25 million cases of COVID in the United States. And out of those 25 plus million cases, we've had over 425,000 deaths. 1 out of every 60 people that get infected with the coronavirus die from it. And that's not even counting the people that get sick and for months and months feel weak and feel short of breath, and that's not even counting those people. These are just 1 out of 60 people are dying from this virus, okay? So that is the big reason why there has been such a push for people to get vaccinated. So the vaccines that are available right now are the Moderna vaccine and the Pfizer vaccine. And Hawaii made a decision long ago to use the Moderna vaccine, which is a good decision. Pfizer, you have to keep it at 70 below zero. Moderna, only 20 below. But that is the reason we don't have it readily available like we have flu vaccines in our refrigerators, right? We don't have refrigerators that can maintain the specific temperatures and freezer temperatures that we need to keep this vaccine viable. So that is why it's coming specially to us on set days at set times, so that we minimize any waste, and it's stored appropriately by the Walgreens people. So these vaccines are called messenger RNA vaccines, and forgive me because I will completely nerd out on this stuff because it's just fascinating to me. But all viruses, all of us, we're all made up of DNA, RNA, and it's all proteins, all a bunch of different proteins, right? So what they did, everybody knows what the coronavirus cartoon looks like now, right? It's this big gray ball with red spikes everywhere, the corona around it. All of those spikes are made up of proteins, okay? So what they did for this vaccine is identify certain proteins on that spike, and they got the messenger RNA that codes for those proteins, and they said, okay, we're going to put this in the vaccine, okay? So the vaccine is just this little ball of what they call lipid nanoparticles, which are like little fatty, oily things just to protect the messenger RNA to get it into your cells, okay? Once that nanoparticle with the messenger RNA is in your cells, the capsule that the messenger RNA is in dissolves, and the messenger RNA is in your cell. It's just in your cells. It's not in the nucleus. It's not going to affect your DNA. It's not going to make you grow a third arm out of your forehead or turn you purple or anything. It's just a protein, okay, that sits in your cytoplasm and tells the cell, make this protein, okay? That messenger RNA is coding for a protein or several proteins on the coronavirus, okay? Your cell makes this protein, and then your body says, what is this protein? This protein does not belong in me. This is not of me. I don't want it. And so I'm going to make antibodies against it to get rid of it. Okay? So that's what it's doing. It's not the virus itself. It's nothing that makes you infectious. It's nothing that can make you get sick. It is just the protein on the spike that we've asked our bodies to make, so that therefore our immune system recognizes it as foreign and goes to work. That's how all vaccines work, okay? You get a vaccine, your body builds antibodies against whatever that is, so that when you see it in the future, your body goes, I've seen this before, this is not right, let me get rid of it, all right? So your immune system is made up of B cells and T cells. Your B cells make antibodies, your T cells where the memory is, right? You have T4 memory cells and T8 killer cells. So, I know, I'm sorry, this is just so amazing. So you get this vaccine, right? And then if you actually get exposed to the coronavirus, your body has already seen the protein on the spike. It's already built antibodies. It's already got the memory T cells saying, get rid of this as fast as you can. And that's how vaccines work, okay? And God bless, this vaccine is 94 to 95% effective. That is amazing. Most vaccines, good vaccines, are 85 to 95%. Our flu vaccines every year, on a good year, they might be 70 or 80%. In a bad year, they're probably only 30 to 50% effective. But we'll take that. That's still 1 out of 3 better than nothing, right? It's still giving you protection. So this vaccine is much more effective than the flu vaccine. And thank God, because this is a much deadlier virus than the flu virus is. I mean, plenty of people, 20, 30,000 people, 40,000 people die every year in the United States from the flu. We're already at 400,000 and counting. And counting, people. This is just insane. And you know what? Those 25 million people that are infected, that's not even 10% of our total population. So 1 year into the pandemic, we are not even 10% exposed, okay? So you guys hear a lot about herd immunity or community immunity. That's trying to get at least 60 to 70% of our population protected, and then that kind of helps protect the rest of us, right? Because if a virus goes out, okay, I'm the virus, I hit you 3 people. If you 2 are vaccinated, I can't get to you, you can't pass it on. If you're not vaccinated, I can get to you and you can pass it on, right? So the more people that are vaccinated or that have been exposed and have immunity, the more blocks we have in the path to spreading it, right? So that is the whole point of trying to get everybody vaccinated, is to keep putting up these roadblocks so that virus has nowhere to go. That is so important why we want to get vaccinated. So I know some people have asked, you know, if it doesn't protect me from the coronavirus, if I could still potentially pass it along, then why should I get it? So that's where the data is right now. The studies were, you know, how effective is it in preventing moderate to serious illness? And that's where you get that 95% efficacy, which is fabulous, right? If I'm exposed, I don't want to end up on a ventilator. I don't want to end up 6 months from now not being able to take a deep breath or walk down the block because I'm just worn out. I will take it for that alone, right? But even if it doesn't give me full immunity and full protection, if my viral load is decreased because of that vaccine and because I have some antibody and some protection in my system, then what I can potentially transmit to you might be less, right? So let's say without the vaccine, I have 100% potency and 100 things are going to go to you. If the vaccine cuts that down to 50 or 20 or 10 or 5, then the chances that I'm infectious to you are that much less, okay? So that's why it's so important that everybody understand what we're trying to accomplish with this vaccine. It's protecting you from getting seriously ill. It's protecting others by making you less infectious. And it's protecting all of us and the people we take care of, right? If we don't get to herd immunity, there is no other way through this pandemic except for more deaths. There's not. I mean, there are treatments that are coming down, you know, but they're not the cure-all. We don't have, like, you know, you can take that Tamiflu if you get the flu and you start to feel better. You know, there's nothing like that right now. There are, you know, remdesivir and dexamethasone. They're doing all these trials and trying all these different treatments, but there is no definite curative treatment for this. People are just going to keep dying. I'm sorry, you know, that's the reality, unfortunately. And this is going to continue. Getting tested twice a week and, you know, for weeks at end and wearing everything and no visitors. And I mean, you know, everybody's suffering from this. We all are miserable in this pandemic. Our residents, you know, our kapuna, they're lonely, they're tired, you know. I mean, I'm out there telling everybody, where's your gown? I mean, we're all tired of hearing it, you know. So there's really no other way through except with the vaccination. So that's the way the vaccination works. And then that messenger RNA, once it's in your cell and it has told your cell, hey, create this foreign protein for me, then that messenger RNA is degraded and it's gone. Within a couple days of the vaccine is pretty much gone. And all that's left behind are the blueprints to make the protein that your body is going to make antibodies against, okay? So that's how the vaccine works. So some of the side effects you might feel are the same side effects you might feel when you feel like you're kind of coming down with the flu or with a cold, because all of your white blood cells, all of your antibodies are coming from your bone marrow. That's where all of your protective stuff comes from, right? And it goes through your lymph system, so you might feel swollen lymph nodes, you might feel achy, but that's why you feel that way, is because your bone marrow has been stimulated, overstimulated. You need to make some more white blood cells. You need to make some antibodies because you've got something foreign that you need to fight. And all of that is causing your bones to overwork, and it's making you achy and tired and fatigued, and you kind of feel lousy. You might have a headache. The injection site could be sore. For most people it is. It'll be sore for a day or two. And for me, seriously, it was. You know, the first one, I was sore for that first 24 hours and then a little less. And then honestly, by the third day, it was completely gone. Like, I can't even tell where I got it. To me, it was amazing because how sore I was the first day and then completely just disappeared. What I have heard and what people have reported is even a week after the vaccine, 8 days, 10 days after the vaccine, where they got the injection, it suddenly turns red or they get a lump there, and then after a couple days that goes away. It's just something that may or may not happen. Doesn't mean you're allergic to it, doesn't mean something went wrong, because if some people ask, you know, if I get too many side effects, does that mean it didn't work? Or if I didn't get any side effects, does that mean it didn't work? None of that. If you got the vaccine, 95% of you, it worked, okay? And that's the other reason we want so many people to get vaccinated, because some people cannot take the vaccine. And for all the people that can, it's 95% effective. And that means anywhere from, you know, 89 to 99%. So if I'm somebody who it was 90% effective, I still have a 10% chance of getting COVID, right? And if it was 99% for you, you only have a 1% chance. You don't know. None of us knows how effective it was in us, but millions of people have taken it. They have data from 30,000 and 40,000 people that went through these trials, and that's the data. That's how effective it has proven to be. So we assume that that's going to be the case for us, you know. And then some people asked, or there's, you know, concern out there about microchipping. So nobody wants to microchip you. The original discussion was, wouldn't it be great if all of our vaccine information could be on microchips, and then you could just know who's been vaccinated and who hasn't? And that somehow turned into, let's stick microchips into this vaccine, which is not the case. There's no microchip in this vaccine. And how many of you go more than 10 seconds without a cell phone? If the government really wanted to track you, you have made it so incredibly easy, because we can't live without our cell phones, right? So that is not a concern. Again, people ask, can it alter my DNA? No, it cannot. Can it make you infectious? No, it cannot. All this is a protein from the original virus. It's not the virus itself. There's no way this virus can make you sick with COVID or infectious to anybody else. It might make you feel lousy, like you kind of feel sick, but that doesn't mean you're infectious or that you somehow got COVID. Because, you know, a lot of people say, oh, every time I take the flu shot, I get the flu. The flu shot does not give you the flu, okay? Now, I will tell you this. It's only effective 2 weeks after you get the shot, right? So if I get the shot today and I'm exposed to somebody with COVID tomorrow and I get infected, the vaccine didn't fail, it just didn't have a chance to work, right? So one shot gives you about 50% protection, the second shot gets you up above 90%, okay? So you want to take both shots. The first one kind of primes your immune system, the second one adds more antibodies, adds more memory cells, so that you have a more robust and longer lasting response if you're exposed, you know, 6 months, 7 months from now.
So who shouldn't take the shot?
So the only absolute contraindication to this shot is somebody who is allergic to any of the components in the shot. So like I told you, it's the mRNA. Nobody's allergic to messenger RNA because it's messenger RNA. But it's in this little ball of lipids, and those lipids are what's called pegylated. So it's this phenylethyl glycol, that kind, or polyethylene glycol, phenylethyl glycol, that holds it all together. It's on the surface. They are presuming that a lot of the allergic reaction is related to that pegylation, to that PEG stuff. So if you are allergic to that, if you've ever had a severe allergic reaction to some other injectable medication or IV medication that's got that similar formulation, then you want to have a conversation with your allergist or your immunologist or whatever. But if you're allergic to cats, if you're allergic to hay, if you're allergic to shrimp, none of those allergies have any cross-sensitivity with this vaccine. Even eggs, you know, because sometimes the flu vaccine, oh, I'm allergic to eggs, I can't take it. There's nothing like that in this. This is really just a ball of oily fat with the messenger RNA. It's beautiful in its simplicity. So then people ask, what if I'm pregnant? Again, there's no reason why this vaccine would affect your pregnancy. This vaccine is just your OB and make that decision for yourself, okay? But I can tell you whether you're trying to get pregnant, whether you're breastfeeding, whether you've got, hypertension, you're going to be worse off if you get COVID than you are if you get the vaccine. That's my educated opinion. So, yeah.
So there are people who have had COVID, but I'm reading that they lose their immunity, especially if they haven't had a severe case.
Right.
So are they recommending those people to get the vaccine?
You can get the vaccine as soon as you've recovered from your COVID, as soon as you're over your infectious period. Now, because we're limited supply, fortunately we are not in long-term care, but out in the community, they're saying, so far they're saying you're pretty protected up to 90 days. After that, it starts to drop off. So if you've had COVID in the last 90 days, the need is not as acute, but you should definitely get vaccinated even if you've had COVID. Yeah. So, some people have asked, if I'm just not sure, I don't want to be one of the first. I can tell you already, one of the first happened months ago, all right? We have already now worldwide vaccinated over 20 million people, so you're not one of the first. So this allergic reaction, the incidence of allergic reaction with the Moderna vaccine, the severe anaphylactic reaction is 10 out of every 4 million vaccines. So you have a 1 in 20 point whatever, 20, you're like 25,000, it's just huge. Your chance of having an allergic reaction is very small. But Walgreens is prepared. They come with their EpiPens, their Solumedrol, their Benadryl. If you have any kind of an allergic reaction, they are prepared to treat it. And none of those people that have had an anaphylactic reaction have died from it. Again, 1 out of every 60 people with COVID have died from it, okay? So when you're looking at the risk-benefit, a potential allergic reaction of 10 in 4 million, really, to me, is kind of lower on the totem pole than actually getting the disease. There are people that cannot take the vaccine because of their immune system. And again, it's not that they can't take it, but it may not work well for them. So if I'm going through chemotherapy, chemotherapy completely wipes out your bone marrow in a lot of cases. So if I don't have bone marrow to stimulate an immune response, there's no reason for me to get the vaccine because it's not going to work. I'm trying to get my own immune system back, and to slam it with something else is not going to help. So probably for people that are undergoing chemotherapy while their bone marrow is suppressed, they can get the vaccine, but it may not be as effective. And same if you're taking immunosuppressants for lupus or rheumatoid arthritis. The vaccine itself isn't going to harm you disease-wise. It's not going to make you worse. You just don't know what kind of a response you're going to get to the vaccine because your immune system does not work wholly, But, some people are like, oh no, I take a lot of medication for blood pressure and diabetes and COPD. You are the people that need the vaccine because COVID is much, much worse. Their negative outcomes are at a much higher rate if you have any heart disease, high blood pressure, kidney disease, diabetes, any of those things are going to put you at higher risk for negative, seriously bad outcomes from the disease. So some people are reluctant because they're on medications for other things. But again, talk to your doctor to get comfortable. But I can tell you your risk of getting COVID and having a bad outcome from it is much worse than your risk of having any problems from this vaccine. So other people asked, if I get vaccinated, can I be around my children? Can I be around my family or my grandparents? You are not in any way infectious from the vaccine. Now, if you've been exposed to somebody with COVID and you're not in your protective window yet, you could potentially still transmit the disease, but the vaccine itself in no way makes you a danger or infectious to other people. So that is not a concern. Some people asked about the cost. The cost of the vaccine is completely free. So I know we ask for your insurance information, and that's because Walgreens cannot bill for the vaccine, but they can bill for the administrative costs. So they can bill for the syringes and the PPE they have to wear and the waste and all that stuff. So they can bill for that. But even if you don't have insurance or if you've got some kind of copay, there are monies in the state that would cover that. So nobody should be paying any amount for any vaccine. And if somebody's offering you a vaccine at a cost, I would question where that vaccine came from. Because all legitimate clinics are free to anybody who takes the shot. So,
I know you guys have some questions because I've had a lot of one-on-one conversations with you. So now's the time to speak up. No question. The only stupid question is a question you don't ask, right? So speak up if you have any questions. She is the lady to ask.
And I can give you stupid answers if that
Very.
makes you feel better.
What if somebody takes a third dose?
If they take a third dose, I don't think anything will happen. I think you might have even more side effects maybe, because you know they say the second shot sometimes will give you more side effects than the first. And again, your immune system's primed, so that second hit is going to stimulate it even more. Some people, second shot, nothing. They were, you know, but I heard even Fauci after the second shot laid low for a day or so, you know. So.
Hey, my husband's a big baby. He didn't have anything from the second shot.
Yeah,
Nothing.
it just depends. It's all very individual. I had coworkers that had a really bad headache for the first day and a half and then just disappeared. A couple people said they felt like they got hit by a Mack truck and then woke up the next day and they were fine. So it's just so variable, but the majority have minimal to no side effects. I mean, of course your arm's going to be a little sore. We just jabbed a needle in and muscle, you know, but small price to pay, right? What else? Let me see. I have some. Let me ask questions.
So, do you know how long this vaccination is good for? Like the flu shot we take yearly? Is it going to be yearly?
We don't know yet. So far the test subjects have been 7 to 9 months out and they are still showing a positive response, but they don't know how long that will last. And thank you for asking because it gives me the opportunity to nerd out again. Now we've got variants, right? We've got the UK coronavirus, we've got the South Africa coronavirus, we've got the Brazilian coronavirus. So far, Pfizer and Moderna have been shown to be effective against the UK variant, which is good. Not as effective against the African one. So, still effective, just like our flu ones, right? Sometimes they're 30%, sometimes they're 80%. So this one is still giving you antibodies, but not as much as against the other two variants. So you do still have some protection. So Moderna is already working on a booster with these new variants that's going to be effective. So you may have to take not this same vaccine, but a different vaccine a year from now. You know, we won't know until we get everybody vaccinated. Because until we get that herd immunity, we don't know, you know, how long things are going to last. Right now we have flu season. Well, not in Hawaii, we don't have any seasons. But on the mainland, you know, you have that fall, winter flu season, and they think maybe that's what coronavirus will do, but they don't know, you know. So we're just kind of waiting to see. A lot of people ask, you know, once we get vaccinated, can we stop with all this ridiculous stuff? No. So you guys all know the Swiss cheese model for failure. You know, if you think of Swiss cheese has holes in it everywhere. So you have to stack enough Swiss cheese so that nothing can get through, right? Because each piece will block a hole. So the more layers you have of Swiss cheese, the less likely something can get straight through, right? Mm-hmm. So this is the same thing. Our masks, our shields, our hand hygiene, our gowns, our social distancing, these are all layers of Swiss cheese. The vaccine. The vaccine is your biggest layer that's going to just let 5% through, right? So this is just one more layer of protection. Until we get to the point where we've got community immunity or herd immunity and we start to see the numbers go down and stay down, they're not going to lift any restrictions. Now, who knows? Maybe they'll say, hey, if your individual community has, you know, sustained down and has stayed down, yeah, maybe we can start letting the visitors in and maybe we can stop with the masks and the yellow, green, red zone and all that stuff, you know. But right now, everything has to stay the way it is until we've got enough people vaccinated. Again, we're a year into it, we're less than 10% immunity. You got to get 60, 70, 80%. you know. So everybody's got to do their part. We got to do the part for ourselves. We've got to do it for our families. We've got to do it for our coworkers, our kapuna. We've got to do it for the people that cannot do it for themselves because for whatever reason they can't be vaccinated. Then we need to try to protect them as well. So, what other questions do you have?
Did they at one point stop giving out vaccinations because the side effects is too grave
No.
anywhere in the world? No.
No. I know when AstraZeneca was trialing their vaccine, somebody got some kind of neurological paralysis type thing, but they determined that was not related to the vaccine, and they resumed that trial. I can tell you, you know, the Moderna vaccine, if you look at the data, they did have deaths in the trial, but they had more deaths in the placebo arm than they had in the vaccine arm. People die, you know, when you have 30,000 people, people are going to die, you know, but none of that was vaccine related. Somebody had a heart attack, somebody had a stroke, you know, but like I said, 4 people died in the placebo arm, 3 people in the vaccine arm. You can't really compare, you know. The other concern people have is the speed at which this vaccine came into being, right? It's like vaccines take 10 or 20 years. How did you guys spit this out in a year, and how can we trust it when it came so fast? So the whole concept of using messenger RNA as a delivery method has been around for over a decade and has been used in other settings, other medications, other vaccines. We are blessed that it was there ready to be used for this purpose, right? The other thing is the messenger RNA itself, the whole genome, you know, what is this virus made out of? The people that identified how it's made and all the proteins and everything involved, they put that information on Twitter. They mapped out the whole genome of the virus and put it on Twitter and said, please, anybody who can do anything about this, take it and run with it. So something that would have been guarded, you know, as, oh, this is for us, they shared it with the world and said, we need all hands on deck. People pretty much just dropped what they were doing to work on this vaccine. The government threw billions of dollars at it, billions and billions of dollars. They subsidize it. So, you know, when you do a new vaccine or new medication, it goes through 4 phases. Phase 1 is when you're trying to understand how it might work and what might work, and you do experiments on that. Then phase 2 is you put it out to people and you try to figure out what is a safe dose and what's unsafe, and are the side effects okay. Then it's phase 3, does it really work? Does it do what we want it to do, and is it safe while it's doing that? And then phase 4 is long-term side effects, right? So usually you do phase 1 and say, oh good, let's move on to phase 2. Oh good, let's move on to phase 3. With this, before they were even done with phase 1, they started phase 2. Before they were done with phase 2, they started phase 3. If anywhere along that point, like if they had started phase 2 and then phase 1 failed, they would have stopped. And I'm sure there are plenty of companies out there that have aborted, you know, multiple vaccine attempts because they have not passed phase 1 and phase 2. Or now they're finding phase 3, they're not effective, okay? But they took a gamble. I mean, this is so serious. They took a gamble and said, we're just going to keep moving, and if we have to stop, we'll stop, but we're going to keep going. And that's why AstraZeneca stopped, because they had some issues, but then they were able to keep going. And then, you know, the companies, I mean, who starts mass producing a medication before they even know if it's working? But that's what they did, because the government was willing to say, we'll give you X number of dollars. If it works, great. If it doesn't, we'll eat the cost because we need you to do this. So before they even had the data, the vaccine was ready to go. Thank God, the data said this is awesome. This is 95% effective, and here's the vaccine ready to go. So what seems like warp speed was just a series of well-calculated, no steps missed, no data missed, nothing dropped. They did all of the steps they needed to do. The FDA usually requires trials of 3,000 people. Instead, they had 30 and 40,000. So the data was just that much more robust, you know. So there were no shortcuts. There were just expedited. Everything was expedited, and the resources were just piled. The money and the people, the brain power all across the world that went into building these vaccines. It's really phenomenal. This is truly a modern miracle that we have this vaccine. And then long-term care. Then we get it first because of the community we serve and the kapuna, and 40% of the deaths from COVID are in long-term care facilities. So they said, hey, this is where we're going first. So that's us. We are lucky that we're the first in line to get this vaccine, and you can get it here. So that's one of the other questions. Oh, I'm still not sure. If I wait and I don't take it now, can I get it later? We can't give it to you. We won't have it in our stock. So if you don't take it when Walgreens comes to give it to you here, you will have to wait until you can get it out in the general community. That could be later this summer, early fall, I don't know. And you'll be in some cattle call, right? Here, you're in this nice building, and it's all controlled, and you know exactly when you're going to get it, and it's just, we're very lucky that we have this opportunity. So I cannot encourage you enough to take advantage of getting the vaccine and being one of the first to get it, and promoting it with your families. I mean, once your family can get it, please, as a healthcare provider,
Yes.
please promote everybody getting vaccinated. Otherwise, we're going to keep having these super spreader events. Oh, we just thought going to this birthday party would be okay, and my God, we can't go to funerals. I mean, it's just ridiculous that
People are dying alone.
yeah, yes. I mean,
know.
there's just so much tragedy that we can avoid if we can just get over this, And again, the only way we're going to get through this is with the vaccine, because nothing else has worked, right? For a year, we've tried to tell people to wear your mask, wash your hands, but we're not doing it, and the virus is winning, right? This is the way we're going to stop this virus. So, I
Great.
don't know. Anyway.
Isn't she wonderful, guys?
Okay. What other questions do you have? I mean, people have questions about, if I'm trying to get pregnant or I'm breastfeeding. None of that should be affected by the vaccine, but again, you just need to speak to your provider and, make sure they're comfortable and you're comfortable with that information. So, what else? Any other questions? Yeah.
Why is it on the form that they gave us, it says it's not FDA approved? Can you explain that part?
So it is approved under emergency use.
Okay.
So emergency use means it's gone through all of the FDA approval steps. So I said there's 4 phases, right? That 4th phase is the long-term study. That's where we are now.
Okay.
Those people that were in the original trial are doing phase 4. So usually they don't approve until you're through all the phases, but because we're in this cluster that we're in, they gave emergency authorization.
Okay.
So that's a good question too. Because people ask, why is Pfizer 3 weeks? Why is Moderna 4 weeks? Why is Pfizer 16 and up? Why is Moderna 18 and up? They can only give the vaccine the way it was tested in the trials. So Pfizer chose 16 and above, Moderna chose 18. Pfizer chose 3 weeks, Moderna chose 4 weeks. So that is how they have to be given.
Thank you.
Yep. Now or never, people. Let's go. Please, please, please.